information.
The engagement equips private sector players with strategies to safeguard their young workforce from acquiring HIV and mobilizing financial support in the face of declining donor funding.
We are interested in the private sector for many reasons. One, because they are the biggest employer in Uganda. They employ the biggest number of people, most especially the young people. And as you may know, when we look at new HIV infections, most of them, over a third, are occurring among young people, especially those aged 15 to 24 years. So if we are working with the private sector, we will be able to reach those young people with information and equip them with the capacity to prevent or protect themselves from acquiring HIV.
The Commission also highlighted the potential costs to businesses if HIV/AIDS is not effectively managed, with reduced productivity, limited economic growth, and increased AIDS-related deaths.
Increased healthcare cost. The treatment for one person who is living with HIV at the workplace, we can compute. It ranges between 700,000 to 1 million. Assuming you have 10 staff who are living with HIV, that means every year you spend about, let's take the upper limit, you spend 10 million to treat these people with other, and this is what costs government, but also at the workplace.
Private sector representatives shared ongoing efforts to protect their workforce from HIV.
As a private sector, DOT services use its own money. Take an example, we try to use the government hospitals where our projects are, but they were understaffed. They could not cope up with the population of workers we have. So we went private, and in connection with Uganda, Reproductive Health Uganda, we partnered with that organization to carry out the HIV/AIDS testing, counseling, and the distribution of what? Of condoms.
The recent statistics on HIV infections show that annually, Uganda registers between 15,000 to 20,000 HIV new infections among young people aged 15 to 24.